I am so happy and blessed that these people came to my home, picked me out of everybody else, and did all this wonderful work that they didn't have to do, and made my house a safe home for my daughter and my grandbaby, Kaylee, who had the blood poison from the lead. It's a blessing when people take time out and for older folks and show the love, because we need more of that in our neighborhoods, to show love and caring for people.
And what can I say? Great and Healthy Homes has been wonderful to the community. And over the years, they've just grown and grown and grown. This is the start. But however, we've gotten better, but we want to work on getting even more, doing more and more and more, so the impact will be less on the community and the houses in the state of Maryland.
You know, we've had such a great partnership with the U.S. Department of Housing and Development and all the agencies, local, that have made such a great difference in Baltimore. It's been not only my honor, but the department's honor to be partners along with you in addressing the issues facing families in Baltimore. Baltimore received one of our first grants back in 1993. And we've always seen Baltimore as a model of this work in building coalitions, being innovators, addressing homes in a holistic fashion by addressing lead and other housing-related health hazards, establishing models of practice, and working with all their partners to make sure rental homes and owner-occupied homes are safe. And we've had so many other successes. This work has resulted in having some of the largest decreases in the number of children with elevated blood levels across the country. These are tremendous accomplishments towards working to solving the problem, to break the link between unhealthy housing and health.
We know that exposure to lead is the most significant and widespread environmental hazard for children in Maryland, especially here in Baltimore. And exposure to lead can cause long-term neurological damage that may be associated with learning and behavioral problems and with cognitive ability loss among our young people. It is painstakingly clear that these issues most impact young people living in traditionally underinvested in neighborhoods. Lead-based paint hazards in homes are the most significant lead hazards. The good news, however, is that lead poisoning is an entirely preventable environmental justice, and early intervention is key. The city has had a tremendous partnership with Green and Healthy Homes Initiative, with our friends at Johns Hopkins, with Parents Against Lead, the Annie Casey Foundation, and many, many others here today. Because of those combined efforts over the years, in 2020, childhood lead poisoning cases in Maryland decreased to the lowest level since data had been collected in connection with the state's 1994 lead law. This work is critical to making sure that Baltimore is the best version of itself in the future, and we will continue to partner with anyone that helps us reduce lead in our houses.
There's been communities all across Baltimore City, Black communities, brown communities, that have been disproportionately impacted by something that should have never happened, by something that should have been eradicated before. And we stand here today as a step in the right direction. But we understand and know that we can't stop, and we can't cheer, and we can't pat ourselves on our backs until we know that every single child in East, in West, in Southwest, and Northeast of Baltimore is safe from being able to go and live in a healthy, clean environment. With HUD, with our state partners, with our city partners, with our mayor, with the nonprofits, to ensure that we're taking a step in the right direction.
The work we do is about families, and the work we do is about the commitment to improve the lives so that kids get to the classroom healthy and ready to learn and to compete for a lifetime. The investment here is about ensuring that families live with dignity and health and opportunity.
People want to live here. People want to live in healthy environments, healthy neighborhoods, where they can raise their children free of lead, stress, of medical conditions that overcome some of the hazard conditions that we face each and every day. Organizations like RUTH, Southeast CDC, but to see the change that is really happening here in our community with the help of these organizations, the mayor, city council president, and many of my colleagues across city government, I'm excited to see the changes that we're making here in East Baltimore.
You know, this work, everybody that has spoken before me has highlighted the amount of coordination and partnership that it takes to advance the work of lead hazard reduction, to advance the work of healthy homes, to advance the work of creating safe places for every generation of Baltimoreans to live within their house. Everybody from 1 week old to 79 or 89 years old all deserve a safe and healthy place to call home. And that is what we are here to celebrate, the work that has happened, and to look to the future to what we still need to do. The team at HUD fully understands the need that exists in Baltimore for lead hazard reduction dollars. And while it is a competitive grant, and we apply and we put our best foot forward, when we are and if we are awarded, they are the first to show up to say, how else can we help you? How can we help you move this forward? And how can we be a partner at the table? And I just want to say that that partnership at the federal level is extremely important to the work that we do. We're lucky right now in Baltimore that we are actively deploying over $13 million of lead hazard reduction grant money from the federal government, and also includes weatherization funding as well. So I want to say that we are here, we have funds, we are in the community, we are working with our community partners, and we are going to continue to deploy those funds.
That what we're really talking about is individual families. Individual families whose lives, the children whose lives are poisoned for their eternity, for their time with us on this earth because of lead poisoning in the property. We all play a role in addressing this problem. There are new resources as part of the stimulus money from the federal government to deal with the issue, to also deal with the issue in schools, that our children can't drink from the water fountains in schools. We're working on that, and we will make a difference there as well.